right, everybody, and welcome to another episode of the Future Ear Radio Podcast. I am thrilled to be joined today by Dan the Man Romero. Thanks for coming on today. How you doing, Dan?
I love that. I'm doing well. I'm doing well. For those of you who don't know me, I am Daniel Romero. I'm an assistant professor at Vanderbilt University, and I've been here for almost 3 years now, which is crazy to think about. But I initially came as a postdoc and transitioned to faculty. Half of my time is really spent doing clinical work, so I see patients half the time of the week, and then the other half is really just expanding the vestibular research program. So I get a little bit of both worlds, and certainly 100% vestib. So I'm really excited too that the vestibular system keeps me going, and the passion is certainly has led me to this point.
That's very cool. So, I wanted to have you on today. You and I were just at the American Balance Society. First time I've ever been. Really like an interloper, just trying to kind of understand what goes on at this meeting. I learned about it through you and Liz Femler, and although Liz couldn't make it this year, you welcomed me and brought me into the fold and introduced me to a whole bunch of the vestibular scientists in this industry. And so I was very appreciative of it, and thought today we could just kind of talk through, as a Ph.D. vestibular audiologist, what stands out in your eyes from this year's meeting, whether it's just new terrain that is starting to be, new waters being chartered, or, kind of advancing some of the existing research. I'll just kind of be curious to hear from you of what stood out. So why don't I kick it to you and you take it away?
Sure. So just to give a little background on the actual meeting itself. My first ABS meeting, or American Balance Society meeting, was around 2016. I was about a second or third year AUD student. This meeting has been going on since about 2009 or so. And really the fundamental vision for the American Balance Society was to not only present research that's on the forefront, more specifically like clinical research that's on the forefront, but also make it a place where it's truly multidisciplinary. Anybody working in vestibular or with dizzy patients, you realize quickly how multidisciplinary this field is. The patients will see a variety of different specialists, not only audiology, but they'll see physical therapy, they'll see ENTs, neurotologists, neurologists. And so there's a lot of hands on the patient and trying to manage the patient through some of these debilitating dizziness and balance issues that they experience on a day-to-day basis. And so that was essentially the fundamental vision for American Balance Society. And it's really kind of unique in that sense, because a lot of the other meetings are not necessarily as multidisciplinary. There's a lot of other big vestibular meetings that maybe contain a little bit more bench science, a little bit more exploratory type research, but the American Balance Society is really, clinically relevant from a multidisciplinary standpoint. So I've always loved it from that standpoint. I've been attending ever since. And so I would say this year's meeting was really, I thought, really nice. It was essentially the first time that the American Balance Society was not attached to the much more well-known American Auditory Society. And so for those who don't know either, this American Balance Society, or ABS, sort of spawned off of AAS. And so for years, it would always be held at the same location a couple days prior to the big American Auditory Society meeting. And this is actually the first year where it's sort of independent on its own in that way. So completely different date and location from the American Auditory Society. And so we still had a pretty nice turnout, and that was nice to see, so many people still interested in coming to this meeting.
Yeah, I mean,
Yeah.
I felt like it was very well attended. Lots of you know, representation from the major hospital systems that have these, you know, large research centers and are kind of on the forefront of that. In addition to a lot of universities, and kind of their research arms, and then also a number of students. So I felt like it was kind of a nice rounded mix of different sort of vantages. But I felt like the overwhelming consensus was like that this was a scientific consortium, um, discussing the stuff that really is kind of at the edges of the scope of
Right.
the practice. So I mean, for me, I would say I kind of just started to get an education in the vestibular side of the profession 2 years ago, and so I'm still trying to wrap my head around kind of the basics. But I felt like when I was kind of trying to absorb what was being presented, a lot of it was around diagnostics, heavy
Right.
emphasis on pediatric diagnostics and that kind of new nascent field. But I just found the whole thing to be like, if you are like a PhD researcher, this was an unbelievable sort of gathering of the best and the brightest. And I have to imagine for something as specific and niche as something like this, it's nice to be around a lot of other like-minded
Right.
individuals that understand this as deeply as you do.
Right. And, just for anybody out there, full disclosure, I do serve on the board of directors for the American Balance Society. So, I am a little biased, but I've always loved this meeting. And you're right. I mean, this year's meeting, I think three main themes that I sort of took away from this. One being the emphasis on pediatric vestibular, which I think is only going to grow. For the longest time, vestibular testing was really limited to, or we thought was limited to, children, as young as maybe 5, but more recent, with more development of the research and more interest in this area, that what we think is possible with pediatric vestibular testing, that lower limit seems to be decreasing quite a bit. And we have so many great pediatric vestibular researchers that are working really on the forefront of this topic area. And so it's certainly nice to see, and it's great for the profession and to reach a whole other target clinical population that may not be able to, in a traditional sense, may not be able to have access to those that type of testing. So that was sort of the first main takeaway. The second was essentially going to be, or what I took away were some of these more convoluted and complex clinical pathways that our patients go through on a day-to-day basis, which I think is just a huge area that, as a field, as a group, we can certainly improve upon. It's not uncommon for a vestibular patient to see 5 to 7 different specialists before they reach the right one. And so I think advocating for patient outcomes and advocating for improving these referral pathways was certainly one of the other major themes that I think was kind of scattered throughout the meeting.
And then the third one?
Yeah, the third one. So I did say 3. So it's the third one. The third one I would say is probably improving. This kind of is evident in not only the clinical side but the research side. There's so many different vestibular tests out there, and the vestibular system itself is incredibly complex. There's different ways of testing it. We use different measures to assess not only how those reflex pathways are structurally intact, but how are they affecting the patient functionally. And so there's a whole wide variety of different tests. and depending on who's testing, may only report one or two different tests, or they may, so there's really not a consistent overlap of vestibular tests being performed clinically, in addition to those being reported as part of research studies. And so, as you can imagine, over the years, that can certainly result in some, with basically, depending on what you're looking at, you may only get one piece of that puzzle. And so there's not necessarily a standardized reporting or standardized outcome of vestibular measures. And so that was sort of the third main theme that I think I took away about us, again, interdisciplinary teams coming together to really improve those reporting outcomes.
Okay, so let's kind of unpack some of this. So the first one, I've touched on this a little bit on the podcast, which is the sort of emergence, I guess I would call it, of pediatric vestibular diagnostics. Again, for me, this is I'm just speaking from what I know, and the first time I had been exposed to it was, I think, last year when I started to hear people talking about doing like VEMPs on babies, and
right.
So anyway, it seems like it's kind of emerging, and I'd say I had two talks that really stand out. I loved yours, and we'll get to that in a minute. But I really liked the talk from the pediatric audiologist at, I believe it was MUSC. Her name was Nauer, and I think her whole premise was like kind of starting a pediatric vestibular clinic within MUSC. And she answered a lot of the questions I had in my mind, which was kind of like, how do you even sort of establish yourself, acquire patients more or less, but more importantly, how do you sort of communicate to the broader medical community of like the role that you're trying to play. So I'm curious of, from your perspective, like what was the sort of aha or the breakthrough in terms of why this whole pediatric vestibular diagnostic, services, why has this emerged? And, I guess like what was the rationale behind why it didn't exist prior to that?
Right. No. I just, again, full disclosure, I am not a pediatric audiologist. And so there's certain, obviously some things that
nor am I.
That I may not be privy to. But certainly from an outsider's point of view, I think a lot of it has to do with the type of testing over the years, or what's technologically possible nowadays to obtain some type of vestibular information. And honestly, the pediatric vestibular researchers that are showing the effects that vestibular loss can have on a patient's or a child's, not only functional development or gross motor development, but also, how does it affect them socially? How does it affect them academically? And a lot of these researchers that are out there are, it sort of builds a revived interest in this area. And so there's certainly a lot of great researchers that are, putting in the work to not only advance our understanding of the vestibular impairments in children, but also testing and really pushing that limit forward. And so, like one of our the keynote speaker for this year's meeting was Dr. Sharon Cushing, and she's in Toronto, Canada, and she's done this type of work for years, and she's just an amazing individual to listen to, and she was just her work that she's doing up there is quite outstanding, as well as Noor's development of the pediatric vestibular program. She has a lot of tight connections with Kristen Janke at Boys Town and that group, and so there's certainly a lot of great researchers that have not only made the case that this is important, but also are right at the forefront to kind of advance our understanding of how there's still a lot to learn about pediatric vestibular disorders, but certainly there's so much there. And I've seen over the last, certainly, 5 years or so, just a really dramatic increase in interest.
like I thought the most interesting part of Naur's, and I apologize if I'm not pronouncing her name right, of her presentation was, this whole sort of process of like almost like validating the science, and then like her role with the other allied medical professionals. And it was like it was like a Herculean effort to sort of acquire those first patient testimonials. But then as soon as she started to prove out the legitimacy of what she was doing, and I think show how valuable that was to be identifying these different, very, rare or specialty diagnoses, then the referrals kind of started to pour in, and had like this compounding effect where, with every new patient, it sort of triggered another 10 people that were coming to see her. And I thought like that was so interesting because it speaks to this notion of like, how big is this market more or less in the sense of like, we don't know because it's such a nascent thing that a lot of these like physicians or whatever medical professional it is would never even think to do that kind of screening or that kind of test. And so it's like to start to, see these early case studies of these programs that are getting off the ground. And then as soon as they do, to have it almost sort of be so validated that it's like, wow, we can't even keep up with this because we didn't realize how much demand there was for these kinds of pediatric testing batteries. So for me, like that was such a takeaway was, it's not to say that these are, like really obscure kinds of medical divisions within the broader set. I think it's like so new that we haven't even fully seen how much of an impact this could all play on the broader scene, which honestly I feel is a bit of a microcosm for vestibular audiology in general, which is kind of like, when it does take root in a community and it's well recognized like a Vanderbilt would be, obviously the triaging is so much different than a place where it's like a vestibular desert, right? Where they don't have that. And so you have these other specialists that are sort of assuming that role. And I think that speaks to like kind of the broader point, which is that because of the scarcity of this type of medical professional, it's like, I think there's way more demand for it in all of its different, in all of its different versions, whether it's for adults or pediatrics, but so much of it is like, I feel like it's a microcosm of the point of like a lack of almost awareness of what this medical professional does.
Yeah. And you know what? I mean, just kudos to her and her team for developing that. There's certainly other programs that have developed at other centers like, Boys Town or Cincinnati Children's or CHOP or, there's a lot of centers that are out there. And, for something, and I think a lot of that is just really trying to convince that this is important. And that's one of probably the biggest challenges, or maybe the more intimidating thing that could kind of prevent or slow down the progression of starting such a program. But, there's certainly, I think, yeah, you're right. It's a very unique and exciting area of vestibular audiology that is taken off. And so it's wonderful to see.
So, I wanted to touch on your talk, and if you want to maybe give a little bit of an overview on what all happened. But the theme and the takeaway that I had was, again, it's kind of along the same vein, which is the notion of like, good is better than nothing. And so, I think that there's always going to be like a gold standard for a full diagnostic lab that can, basically with high precision diagnose the problem. But it's almost kind of like the hearing assessment screening market. It's like there's still a big role for people to have almost like a pass-fail, understand who are the candidates that need to be referred on to a higher degree of diagnostics, I guess. And, I feel like you were like that the trip that you all did into Poland really, I think, emphasizes this point of like, you don't need really expensive high-end equipment to perform the vestibular equivalent of like a screening. So, again, because of the circumstances of where you guys were and how your setup was and all that. So do you want to speak a little bit about your trip and then, kind of like touching on that theme?
Yeah. So we piggybacked on a team that was already going there to provide hearing screenings and provide hearing aids to the Ukrainian refugees that are currently in Poland. And so we piggybacked on their trip twice last year, because we did find a need that a lot of these refugees were experiencing dizziness and balance problems. And so we went over there. We had very limited equipment, basic V&G goggles, and then we had some VHIT goggles, or video head impulse test goggles, where we could identify some impairments. And I think building, almost like an enhanced bedside screening protocol that could identify. We definitely caught, cases of BPPV. We caught cases of peripheral impairments. We definitely saw some central cases. And so putting that together with just talking to the patient and putting case histories, we were able to kind of identify a lot of these. And so certainly, one of the things, this was one of the talks that I presented, and also acknowledging that, yes, this is a limited evaluation, but I will say there are gold standard tests that we use to diagnose these things. But even, and this was brought up at the meeting, even these gold standard tests, if the testing is normal, that doesn't necessarily mean the vestibular system is not affected. Even our best tests may miss some underlying impairments. And so, there's certainly, I think, international need, as well as, obviously a domestic need for vestibular testing. There's, patients that obviously can't get to a medical center, that may not have health insurance, that may not be mobile, or may be in more low-income communities. And so this type of trip is just one way of just, kind of igniting or starting the conversation about, perhaps, yes, it is not a standard vestibular assessment, but could be used to possibly go to a patient and provide some type of screening and some type of information or management for them. Obviously, if you're providing some type of follow-up care, or if you bring, let's say, a physical therapist or something like that. And so that's certainly a way that some of these patients can get some access to some of these services. And so that was a great experience. And so we're continuing to follow up with these patients and possibly going back later this year.
Yeah, I mean, again, I think that if you can, like you said, there's like domestic implications of what you all did, which is, again, I think as far as I know, like I know within the group that you went with that organized this trip with King Chung and all that, this was the first time you guys had done sort of like a vestibular offering. But I'm not sure. I'm sure there might be examples, but I've not really heard of anybody doing these types of humanitarian trips and having a vestibular screening assessment kind of offering in there. And again, I think that it's because I think there might be like a preconceived notion that that's not doable in a setting like this. And you guys kind of like proved that wrong.
Yeah. I think it's certainly unheard of. And the fact that we were able to go over there and treat at least one person with BPPV and fix their issue in a few minutes, I think that provides all the justification that I need, and yeah, we don't necessarily think about it in this way. And yes, it's not perfect, and there's certainly things that could be improved upon, thought about differently. Absolutely. I don't claim to have all of that figured out, but if it starts that conversation about, okay, what we thought vestibular testing was only possible this way. Now, okay, well, let's see if it opens the conversation about possibly going to the patient and doing this type of testing, then okay, does that open the possibility of more patients being helped, or maybe help the ones that are falling through the cracks? Then, certainly then I've done my job. If it starts that conversation in that way, certainly then that I'm happy.
Yeah, no, I think it's really cool. Like, again, I think you've proven that at least some of these things that maybe were considered to be non-starters are not as big of a detractor, I guess, as it was initially thought. So I'm with you. I think it'll be interesting to watch as this kind of continues to evolve. Again, now going back to the 3 kind of key takeaways that you had in that second bucket where you said, I believe it was like clinical pathways. One of the things that I kind of took away was this whole dynamic. And so I don't know if it falls into that category, but this whole dynamic of the audiologist and the different professionals that you're working alongside. Like you said, a lot of different medical professionals are kind of interacting with this patient. And it seemed like that one of the themes was sort of, kind of like people working through that dichotomy, I guess, or that relationship with these other medical professionals, and then maybe better understanding how to interact with them, or the right instances, I guess, in those clinical pathways as to when it's appropriate for the audiologist to like intervene or to then hand it off to someone else. So can you speak to that a little bit about, like, again, the relationship with, say, the physical therapist or the occupational therapist? Like, were there times throughout this meeting where maybe some of your thinking was adjusted in terms of like how you would be working with those kinds of allied professionals?
Yeah, I think each professional has something to add, and certainly audiology is valuable in identifying some of these structural impairments that may be explaining a whole variety of different symptoms that a dizzy patient may experience, and really providing that objective data. And then obviously, management and working with patients functionally, the physical therapists, the vestibular PTs are absolutely invaluable. And so they're rehabbing these patients the entire way through. And I think it really depends. It's so specific on the specific institution that, patients may end up with physical therapists first. They may end up with audiology first if they're getting referred. And a lot of that really has to do with who's referring the patient. So, if they end up with ENT first, they may likely end up with audiology first. Or if somebody's underwent a concussion and they're being referred by neurology, they may send them directly to PT first to try to really get them back to a point where they can return to play if they're a sports if athlete or something like that. And so there's certainly, I think, a lot of it likely has to do with the population. There may not be one single protocol that can be applied to every single patient, but it likely not only depends on the resources that your institution has, but also the patient that you're seeing. And so if setting those protocols and developing those protocols that can be implemented at a maybe larger scale, depending on, what type of patient is walking through your door, perhaps that protocol can improve or reduce those number of visits that patients are experiencing on average. And obviously it's a huge healthcare burden, not only, it's not only on the quality of life of the patient, obviously, but also financially.
Yeah, again, I think that was sort of a testament to the like maturation of this segment, is that it's not fully fleshed out. They're still trying to kind of work through, like, again, the role and how they fit into this like broader ecosystem, I think is really interesting to watch. And that then leads me to where I'm seeing a lot of this coalesce is with
concussions.
And so, man, I wish Liz was here right now, because I know this this is
that's her wheelhouse.
right in her wheelhouse. But I find this to be so interesting because, in the span of time that when I really started to understand this from Liz, which is probably like a year or two ago, it just seems like there's been more and more momentum. I talked to two different people that were saying that they're now sort of in this new role that's like the concussion audiology specialist. And so again, I think that what's so interesting is how, these kinds of things, they sort of take on these forms as the science kind of continues to progress. And it's like market economics mixed with science, where I think in this space, it's like very apparent that there is a kind of this like need for somebody to play this role that's not a neuroscientist. It's something that works adjacent to that. And again, like with something like concussions, where it's not a new thing, but all of the new attention that's been given to better understand it, I think has really sort of put audiology in this very interesting position where it's like, because of the equipment and how it can be dual purpose towards some of these different diagnostic tests that are highly relevant for concussion, it is kind of right place, right time. But at the same time, I feel like the audiology community is now seizing this as like a really good opportunity to, again, put themselves in a higher level playing field with the other medical professionals sort of that are all interacting with these kinds of patients. So I felt like, and I'd be curious just to hear from you, like it just seems like that's a specific niche within this niche that's really starting to heat up.
Yes. And it's almost like, we talked about all of these, obviously, limitations and things that we still haven't figured out in the regular vestibular community. And yet, on top of that is now a TBI community that can be much more varied, much more complex. And so it's almost like, professionals are being forced to, are working with these patients. And yet, it's almost like the research is not too far ahead of what clinicians are doing clinically,
Sure.
because these patients are coming in through their doors, and we need some type of they need some type of help. And so, there's certainly a lot of fundamental questions that I think exist with how vulnerable is the vestibular system in traumatic brain injury, and some of those more fundamental questions, and how does it recover, and just the interactions between the vestibular system and non-vestibular systems or cognition. A lot of there's so much there that still has to be fleshed out, but yet it's still equally important to use what we have to provide some answers and some objective data for the patient, as well as the referring provider, who may be the main professional that is outlining their plan of care, the patient's plan of care. And so certainly there's a lot to be learned, but there's a lot to be there's a lot currently happening, and there's a lot to be gained with audiologists getting into working with patients with TBI. Incredibly complex area, but certainly the testing that we do can provide a lot of information, not only, especially if you're doing a lot of functional testing too. So if you're not only looking at the structural integrity of these reflex pathways, but how is it affecting them functionally? There's certainly a lot of data to suggest that these functional vestibular tests are much more valuable, especially in this population specifically.
Very cool. Okay, so as we kind of come to the close, the last point that I felt like should be mentioned that very much ties into some of the conversations that have been had on the podcast recently is the sort of emergence or the rising interest among students around the vestibular sciences. So it was really kind of apparent here again that, there were lots of students at this conference relative to the size of it. And, every one of the students that I had a chance to talk to was sort of reiterating this point, which is, I mean, I think you have to have some sort of disposition, or that might not be the right word, disposition toward like the vestibular sciences and be interested in this stuff. But I find it really interesting that a lot of the students that I've talked to very much are looking at the long-term prospects as an audiologist and seemingly understanding that there is maybe job security in this niche, which I don't know if I feel like it's as, if I'm comparing the two, if it's two things, I'm comparing like people that are pursuing the non-vestibular path and just more of a general path. Even the general path seems to sort of emphasize this, with a lot of students saying they want to work in hospitals and they want to work in the VA. They want to work in settings where maybe there's more of a focus on the medical side of things and not as much on the sales side of things. So it could just be consistency with all of this. But I just find this to be very interesting, talking to students and hearing why they're getting into this space is a resounding sort of like, I'm doing this because it feels like one of the safer paths for me.
Right. Yeah. I mean, that's totally true and accurate. I mean, when I was just getting into this as an undergrad, and then early on in my grad program, I was pretty much the only one that was interested in vestibular, and that was pretty consistent. There were very few. It's like the dark corner of audiology is vestibular, and so there wasn't many. But even in just this short amount of time since I've been out of school, there's so many. I feel as though there's so much new interest in the students, and a lot of that I think is just demystifying what vestibular testing is, and it's not necessarily the big bad scary thing. It's certainly doable, and even if you don't want to see do vestibular testing, you're a general, you're a kind of well-rounded audiologist, but you want to focus more on the hearing side, you're going to see a dizzy patient. A dizzy patient is going to come through your door. It's not only one of the most commonly associated things with sensorineural hearing loss, but there's a whole huge aging population that is at risk for falling, and vestibular impairment is an independent risk factor for it. So it's almost like you can't get away from it. So you're gonna have to interact with a dizzy patient at some point, and having those skill sets to be able to provide that additional value to not only your audiology practice, but also to a lot of these referring providers, and to be able to provide a whole new referral pathway is certainly great. And with regard to the students, I love working with students, and I love hearing that more students are becoming more and more interested in this. And us as vestibular audiologists, educators, teachers, we really have to foster that development and that curiosity, and really be able to embrace that curiosity that these students have about the vestibular system, and also point them in the right direction. If you're not fully equipped to provide that to the student, there's certainly a lot of great vestibular audiologists across the country that love working with students, and now are being able to train students to not only specialize in vestibular science as a post AUD grad, but also if you're interested in a Ph.D. in vestibular, there's now growing areas and places to go.
Yeah, I mean, again, I find this to be very interesting to sort of see where the future is moving toward, and in this instance, obviously, I'm referring to the labor of the industry, but I do find this to be something that kind of continues to get reinforced at every single one of the different trade shows I go to, which is that it seems like there's a rising interest in within the student body and the next wave of audiologists to become not necessarily just specialists, but also just more well-rounded and have a pretty good grasp of the how it all works. And then again, I totally agree with you that there's so much crossover, and so one of the most recent episodes I just did, we had a whole conversation about, kind of like, with students in particular and like coming out of school and then, on one hand, you're sort of faced with this potential scenario where the industry and the profession of audiology gets disrupted and on the hearing healthcare side with the, the treatment of hearing aids and all that. But then on the other hand, you have this nascent niche of audiology that has sort of been relegated for a long time. But now I think because of what's happening and all of these external threats for the sort of traditional, audiology pathway, it's just like, it's kind of like a pendulum, and it's swinging back, and it's kind of like, okay, like maybe we should focus on being entirely well-rounded as a means for differentiation with the hearing aids. So anyway, I kind of go on and on about that all the time, but it's just really interesting to kind of find out from these things with like empirical evidence of people coming up and being like, I'm talking to 5 students and they're all basically saying that like, I want to make sure that I'm protecting my future, and I feel like this pathway is a little bit more secure. So I just find that to be pretty interesting.
Yeah, that's great.
So on that note, any closing thoughts? Where can people connect with you?
Yeah.
Link up.
Yeah, no, anybody interested in learning more, or from a student perspective, some of our training opportunities, I love connecting with students, and certainly at least pointing, questions about who you could work with in your area or anything like that. Certainly don't hesitate to reach out. There's you can reach me out at daniel.romero@vumc.org. Any soon to be graduating AUD students interested in an additional fellowship year in vestibular science, where you'll get more clinical experience as well as some clinical research experience. We do have a fellowship program here at Vanderbilt, and so feel free to contact me if that's something that's interesting to you. I know there are also other centers that have fellowship programs, Cleveland Clinic, I believe, as well as MUSC. So excellent centers, excellent people out there. So, we're not the only one. There's certainly other centers that do have that. So there is that opportunity to get some additional training. So again, yeah, feel free to reach out about any to me or anything about vestibular at any point in time.
Awesome. Well, thanks again, Daniel, for coming on today.
Yeah.
Thanks for everybody who tuned in here to the end. We will chat with you next time. Cheers.